Yeah, the one for 10-2 is your first.
I am not, not hanging out here, okay? But you're not going to be, serving down?
Yeah. I'll show you what it's like to bring over.
Like there, the tires or anything like that?
So, I mean, it's working, but I don't know how to play it out. I can't tell. Oh yeah, there's some in there, but not. Wait, so when it was plugged in, you know that timer that you press, it was flashing red. So if it's flashing red, that's one of the things. So the guy, there's a lieutenant at the and he knows all about these. So I think our best option is to swap it out with one of these from 24 or the 31 trailer, get it running, and then get all the physics stuff into them and do a quick once over and see what's going on. Okay.
I would suggest when we get these things out, otherwise we don't know how long it's run on.
Hey, how's it going?
Hey, good to see you.
Yeah, good to see you too.
Stay by it. Get a mask.
Yes. Give us just a few minutes. We're going to set up right here for us.
Just gonna hang out.
Also on your phone, there's a number for the service trucks also. So if you can't get hold of anybody at, just like to answer. Because I think service truck 1 and service truck 2, I think are phone numbers. You can try.
Well, we're going to get things.
Yeah, funnel for the fuel.
I get these guys. Those nuts. Hot washers, No, I watched the tape. I watched the tape and
One of the fuel containers was full.
There was one.
Down on it. The gas can is dead.
Okay, so we need. Yeah, no, but I'm guys get tired of trying to fix this, let the heating guy know and I'll come out and show you what it is.
Have at it, man. Have at it. Come on, man. Through. You ready for this?
Well, it's a circular, it has a return line, so it should be. See how it has an area? And then it's got another return line to go back.
Yeah, so sometimes I'm here on the inside getting
Look at the fuel difference too. I don't know, guys. Yeah. We're seeing Michael or Matthew as a moment to figure it out. Well, it's on your guys' radar.
Take a step into the tent.
What's that?
Take a step into the tent. I'll take it. You guys want to get an interview real quick?
Yeah.
Do a quick interview about
Sure.
stuff.
Yeah, all right.
Right. So, I'll hold this.
What are you going to ask? What? Hi. Good. Good. Camera or look at you?
I'm with radio. My name is Rosemary Reynolds with KXL. This is Eric Patterson with KGW.
Okay, great.
Just look right at Rosemary.
All right.
Well, tell us your name.
My name's Owen Cheevers. I'm a firefighter at Station 1, downtown Portland. Yeah.
Tell us, you just had your shot. Are you glad you did it?
Yeah, absolutely. I'm not necessarily that nervous, or never have I been that nervous about actually getting COVID myself. But I feel like, that's the thing to do, just our societal duty, like herd immunity. The more people that get it, the quicker we can go and get back to normal. So I encourage everybody to get the vaccine.
And do you think that people seeing you get it is an encouragement to them to feel confident about getting the vaccine?
I hope so. I know that different doctors and other medical professionals in my life, seeing them get it and reassured me in getting it. I was at first a little nervous about being in the first wave, but so many people that I do respect have gotten the vaccine at this point that I'm not afraid.
So this is the first of 2 doses for you, correct?
That's right.
Okay. And so will you be resuming your normal activities today? What will happen?
We've been instructed to not necessarily resume normal activities. We're going to continue wearing masks and continue social distancing, and so life as normal has become. Hoping to eventually get back to normal as more people get the vaccine.
Did this feel like a big event to you? If so, why? And if not, why not?
Well, it does seem like a big event. I'm on the camera. You guys are here right now. There's big tents. So it does seem like a big event. And we've been waiting for this for a long time, right? This has been going on for a long time, where we're just now getting the vaccine. So it seems like it's a long time in the making. Yeah. All right. Yeah.
Awesome.
Yeah.
Good work on the mic.
Yeah.
Thank you. You can just set it right back down there. Tell our next one. Yeah.
Okay, so now. So, we'll get you guys back up so that.
Here, I can, right now.
We'll do a sound check real quick.
Really nice.
Sound check. Check 1, 2, 3, 4. Hello, hello. I'll need to hold it up. Okay. So, Alan, when I go to introduce myself, I'm gonna have to do that. Let's do a quick run. I'm gonna have Alan just kind of demonstrate how the mic can go, I guess. And will you instruct him how? Is that good? Check 1, 2, 3. 1, 2, 3, 4, 5. Okay, good. All right, that's good. Yeah, that's it. We're gonna swap, and then you won't worry about it again. Okay.
Will you wrap up?
What's that?
Will you wrap up?
Yeah. Yeah. Oh yeah, probably. Yeah. Okay.
Thank you.
So Chief, I am going to just introduce, I'm just going to give everybody's names real quick.
Okay.
And then I'll have you come out right up to the lectern.
Okay.
Probably from here. Just because we've got a pretty distance. I've got Janet in the backdrop shot, you know.
Yeah.
So that's how we'll get started, okay?
They're not going to be in it.
I just don't have the room, to be honest with you. All right. Okay, so Alan,
Yep, you ready?
well, good morning and welcome. Glad you guys were able to make it to a very special event for us. This morning we do have Chief Sarah Boone, Union President Alan Ferschweiler, and our Chief Medical Officer here at Multnomah County, Dr. Jen Vines, who are going to have a few words for us and then also be available to answer any questions. So without further ado, we'll go ahead and get things started with Fire Chief Sarah Boone.
Good morning. My name is Sarah Boone, Fire Chief for Portland Fire and Rescue. And I just want to let everybody know today is a historic moment. And it's a moment of relief. And just like our peers, when it comes to healthcare workers in the hospital setting, our firefighters, EMTs, paramedics, when it comes to the pre-hospital setting, we see the same patients, along with our transporting agency, AMR. So today is a historic day, and it is a relief. And it offers us hope. And I just want to thank the City of Portland, Multnomah County, the State of Oregon, Local 43, the International Association of Firefighters, Local 43. Me and President Ferschweiler have been working hand in hand this whole year. I have the responsibility of a fire chief to care for 700 employees, and I worry about them every single day. As union president, it is his responsibility to care for a labor force. And this has been a tough year for everybody. And so this day is, it's historic, and it couldn't have come soon enough. Thank you.
Thank you, Chief Boone. My name's Alan Ferschweiler. I'm president of the Firefighters here in Portland, Oregon. I want to say, as we watch all these rigs drive by and the 700 firefighters in the city of Portland, we are very proud, along with Chief Boone, to watch people come and be able to start the vaccination process. It's very important for us. This has been a very difficult year, And as the chief and I have discussed, we never thought 2020 would have been what it is, whether it be the pandemic, the social unrest, the wildfires. And today it feels like we're able to start a new day. Today, the last day of 2020, to be able to start 2021 on a good foot. As we go out, and I'm still blessed to be able to work on the line, to be able to respond to emergencies. Every day our firefighters go out, we're in hazmat suits to be able to respond to those that might have COVID. And today is the first step that we can to help protect not just us and our families, but also the public. And it's been hard for us to be able to go out and respond to people's homes, along with the nurses and the doctors and the social workers and everybody that's been going out to help protect the public, to know that we need to protect those that we respond to. And this is the step that we can do to be able to do that. So I'm very proud of today. Thanks for everybody that's made today happen. Thanks for our members that have stepped up day to day to protect the citizens of Portland. And thanks for everybody that made this vaccine possible and everybody that worked hard to get this day where it is. Thank you very much.
Good morning, I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer and the lead health officer for the Portland Metro Counties. It's exciting to be here this morning to see our public servants and first responders getting the vaccine just in the same calendar year as we documented the first case of this virus in the United States. These are our public safety and first responders, so as their medical director says, you call, they come. So this is part of our phase 1, group 1 of healthcare workers, emergency responders, and really the beginning of a large effort to get people this vaccine that's been approved from an effectiveness standpoint and a safety standpoint. And I'll go ahead and answer a question that many have asked me today, which is whether I've been vaccinated or will get vaccinated today. I would be very glad to roll up my sleeve for this vaccine. I look forward to that day. But the truth is, it is not my turn yet. I don't do routine patient care. I am almost exclusively teleworking, and I want to see this vaccine go to the people who are on the front lines, like those who are here today. So thanks so much for being here.
I want to thank Dr. Jennifer Vines for being here. I also want to recognize a few people within Portland Fire and Rescue that made this day possible as well. And I want the public to know that Portland Fire and Rescue, it's not just firefighting. We're an all hazards department, and we are emergency medical service provider. And with that being said, it's not just COVID. We can be exposed to airborne pathogens, bloodborne pathogens, and so we have a whole emergency medical section that deals with protocols. We operate under the authority of the Multnomah County Emergency Medical Director, physician, and when the county health, or when the state of Oregon incorporated the EMS side into the Tier 1, we had a limited amount of time to ensure that we met federal CDC requirements, the requirements and the mandates from the state of Oregon, as well as the county health. And so our occupational nurse and EMS program manager really was the pillar and the person behind getting this in place today. And then I also want to acknowledge Deputy Chief of Training Tim Matthews, who was able to orchestrate the schedule when it comes to how we rotate 520 firefighters, 31 stations, 3 different shifts to get vaccinated. So this has been a massive effort, and not only with those two, but this required every section of this department to bring us to this moment where we could carry out the requirements, whether it was the logistics, whether it was the cold storage supply chain, whether it was cold storage monitoring, whether it's getting our paramedics trained to administer whether it was understanding how to upload information to the Oregon Alert database, as well as having the required medical equipment in case there were adverse reactions. So I just want to acknowledge our EMS program manager, Janet Woodside, and Deputy Chief Tim Matthews.
Good morning, I'm Tim Matthews, Deputy Chief of Training. Like the Chief said, I was responsible with my team setting up the logistics of this operation. In some ways it's a beta test of what we hope to use in the future. And after 9/11, the federal government supplied most fire departments with the equipment necessary to become all hazard agencies. That includes these trailers to this side of it you see and the tents behind us. That gives us the capability to respond on incidents other than fires, whether it's earthquakes, pandemics, sea burning incidents, or biological, situations. So in some ways, this is a forethought of our government equipping us this way to have this capability. And what we have going on today is, like the Chief said, 30 stations, multiple rigs coming through in a sequence that allows the city to maintain its response reliability. So every community and neighborhood is still protected while we're running the apparatus through quickly to get their immunizations. So that's kind of the setup here. We also have a lot of staff personnel that are secondary responders that also work the line that are coming out here for their vaccine. And it's all basically just to keep us all safe and get everybody prepared and protected going forward. So. Thank you.
Awesome. So at this point, then we will open up for questions. I'll ask for my speakers. We'll keep our masks on for questions, just we'll be maybe rotating a little bit. So I'd like to just go ahead and open it up then. And Chief?
So today we have approximately 230 firefighters that will get their vaccination. Tomorrow and the next day we'll run through about another 200 each day. That's correct. We'll progress forward to the other public safety agencies in the following weeks, and then in about a month we'll repeat this for the firefighters for their second dose. How are the firefighters doing that? How COVID doing? Are they all vaccinated?
Yeah, we've had about so far 34 firefighters that have contracted COVID, and we have currently about 8 that are still off finishing their quarantine, and a few are still symptomatic, but luckily nobody's hospitalized and they're well on their way to getting back to good health. Sure, it's Janet Woodside, EMS Program Manager, the nurse for Portland Fire and Rescue.
Ironically, we're at the training center. It's about the challenges when it's not COVID safety and training effort. How do you navigate parallel duties between the training?
So, being at the training center and having it as a vaccination point also is challenging in that this location is kind of in the far northwest of the city. So we want to have our apparatus respond here from different areas of the city, so we maintain fire protection in every neighborhood. As you can see, we social distance and set tents up so we can keep airflow going instead of doing it inside a structure. All the vaccinators are wearing proper PPE with goggles, N95s, and gowns. and then we're only allowing so many people inside each location at a time. And then we have actually a handler that is escorting people into and out of the tent. And then you'll see them drive by us, and then they go and stage for a waiting period in case there's any type of side effects. And so there's a set time limit for them to be observed before they can go back in service. Does that answer your question?
Was it a juggling act though between training, firefighting, training, and COVID safety?
Yeah, luckily enough, right now we're in a period where our recruits are transferring from the normal training academy to a station where they continue their training on a shift rotation. So we have 11 recruits that are paramedics. So we were actually able to put them to work today and the next 3 days and next week, given the vaccine. So it really worked out that we were able to use our staff that are currently at training to work as vaccinators and save us a lot of money actually as far as overtime and so forth. So we were fortunate that it happened at this window because it's not something that normally happens. So that worked out well for us this time. Yeah, when you have a vaccine that's invisible or any threat that's invisible, and fire, it's on our mind already on a lot of calls. We've had other viruses that have come through that have equipped us with the proper equipment. There's radiological devices, and so we are hazardous materials. So we have protocols in place for those invisible threats, let's say. But this one, it's all around us. If you do the math, it's a 1 in 2 in 100 or so forth that you're coming in contact with potentially could have it or could be exposed to it. So, it's a difficult situation for everybody. We are fortunate to have some training and the proper protection, to respond to it. And even then, we're not immune. So it's something everybody needs to be aware of and educated and practice good personal hygiene and do what they can on their side too, right? The firefighters are by nature, responders, and it's hard for them to not rush in, on EMS calls. They don't want to sit out in the rig and have the person come out, but we've had to slow them down and put protocols in place for everybody's welfare. So it's a little bit against their nature, but so far they've handled it well, I think.
I will say this has been the hardest year of my entire career, and it's a lonely place to make sure that your entire workforce remains safe. For me as a fire chief, I have an understanding of every position because that's what I did, is to rise through the ranks, whether it was a firefighter on an engine, whether it was an officer, whether it's being on a truck, whether it's being in a residential area, downtown, uptown, whether it's being the safety chief and understanding risk and how to minimize that before our crews go into environments and hazards that have the potential to immediately take their life. It all comes down to the planning and preparation before you send people into harm's way. But this virus, right? We didn't have that time. There wasn't the preparation. And our personnel, just like everybody, there was no level that we could give them to where they would be safe. So that has been daunting to carry that weight this whole entire time. knowing that we provide the best personal protective equipment. There's multiple environments that they go into. They can wear 5 different levels of gear depending on what they face, but it was never good enough. It was never good enough. And so from the beginning of this pandemic, nothing has changed as far as there is no cure. And my biggest fear was to lose somebody in a fire because they fell sick. And then they couldn't carry out a task. And then an assignment couldn't get completed. Then you would have cascading effects where we could lose whole crews. I carry a radio. I have a radio at the side of my bed that I listen to every night before I go to bed. And what our personnel have faced this year, not just with COVID, not just with social justice and civil unrest, as well as the wildfires, but every day something can take their life. And this is the first day I will be able to sleep really well.
Okay, so unless you guys got any further questions, I think we're going to go ahead and wrap up, and we'll get on to hopefully getting the chief vaccinated this morning. All right, thank you. Probably not. We'll see. Yeah, I can probably get the Oregonian guys easily. The all